Hello, my name is Margie Maupin from Kauai. I want to thank you for the time you have taken to listen to my grave concerns about the health of the West Side people. I have talked with each of you about these concerns, and although Ms. Nakamura is not a council member any longer, I want to thank her and you, Councilman Raposo, for speaking with us West Side healthcare providers in Waimea recently. On the day we met on the West Side, the doctors, nurses, and other healthcare providers shared their very troubling observations. More babies born with missing ear canals, malformed ears, recurring nosebleeds, cleft palates, asthma, allergies, rashes, hormonal imbalances, more frequent miscarriages. One of the doctors who brought us each a stack of about 200 pages of studies showing the serious dangers of pesticides expressed concerns about how to answer his pregnant patients who ask if the pesticides will harm their baby. Most appalling from a West Side pediatrician and obstetrician was the report of serious heartbeats or birth defects, 10 times the national average. Some of these are incompatible with life. In other words, the heart defects are responsible for the baby's death. With that said, I have another related concern to share if the veto is not overridden. I am very unsettled about my duty, of providing primary health care to my patients and their families on the West Side. Thousands of reputable studies have already been done that show pesticides are known hazardous toxins. The probability that these pesticides will hurt a lot of people on the West Side, I believe, is high. I implore you to override the mayor's veto because some healthcare providers are already seeing signs of serious illness and disability now, and we are at a loss for how best to protect our patients from this onslaught of known dangerous exposure. I have been very active in my efforts to pass the Common Sense Bill 2491. It is a start to protect my patients and their families. I can tell you something without any doubt. To this day, the mayor has not made any attempt to dialogue with me about the West Side residents and their health. To my knowledge, the healthcare providers I am in contact with have also not been approached by the mayor to talk about these concerns. Additionally, I have called or emailed numerous governmental and non-governmental agencies, including but not exclusive to Mr. Gill at the Department of Health, who never returned my correspondence, Department of Agriculture, March of Dimes, National Institute of Health, Hawaii Cancer Institute, the CDC, OSHA, and multiple others, and the same message has been offered over and over. We're sorry, no recent data, and there are reporting flaws. When I called these agencies, I was grasping for assistance to understand pesticide exposure, receive training, education, prevention, find protocols to respond to chronic pesticide poisoning, or any information at all that would help me best care for my patients.
I have to tell you that 3 minutes went up, but you can summarize, please.
Okay. Don't depend on data that is not up to date and is poorly collected. Look at the recommendations from the American Association of Pediatricians. Listen to the sick people. Listen to the healthcare providers. This is not the typical mix of sick people seen here and there. This is a dire situation. You, the county council members, are at a crossroad in history. Will you do your best to protect the residents of Kauai?
Thank you. Mr. Hoosier has a question for you. Mr. Hoosier, you have the floor.
Yeah, thank you. Thank you, Chair. Thank you very much for all your work on this issue. I know you've put a lot of your life into this, and I appreciate it. And I understand that you're closely connected with the medical community on the West Side. In today's newspaper, the Department of Agriculture and the governor issued a press release saying that they'd consulted with the chemical companies and come up with some voluntary guidelines. Are you aware if any of those, the Department of Agriculture or the governor has consulted with the medical community on the West Side or KVMH or yourself recently?
None of the doctors that I practice with have been contacted. I'm not sure about KVMH in general. I work for the community health clinic that's housed within KVMH. But I have reached out to the Department of Agriculture myself and have not gotten responses, or I've been referred to other people who have not called me back.
Okay. Thank you. Thank you very much. Thank you, Chair.
Thank you. Councilwoman Yuki Murray, you have the floor.
Margie, I want to thank you, too, for all your work on this. In the data that the doctors gathered about the birth defects and so forth, did they do a screening in terms of tobacco use of the mothers or the families?
I can't say if they did or not.
Okay.
It was mostly the senior obstetrician at KVMH and the senior pediatrician there, and I'm not sure what details they gathered other than the birth defects themselves.
Yeah, maybe if we can move this EFIS or this environmental public health study forward, we can do those kinds of things and really look closely at that data, because it is disturbing.
Yes, it is disturbing.
I mean, it's clearly a signal that we should do a study of some sort. Thank you.
Thank you for your testimony.
The next speaker is Robert.